Hello everybody, welcome back. This is Dr. Marc DuPere, plastic surgeon, Visage Clinic here in Toronto, beautiful Canada. I want to say first, thank you to my lovely lady for agreeing to this filming. This lady has lost 150 pounds. She had a stomach procedure, the so-called Roux en Y procedure back many years ago, and she's kept that weight off for many years. She came to my office. We discussed many options. She needs arms, she needs legs, but she wanted to proceed first with the trunk, the body, the buttock, the abdomen. So today we're doing a lower body lift, which includes a lifting of the buttocks and a tummy tuck in the front. So from the back first, we're going to do some liposuction to remove the excess. This is what I'm proposing to remove. I may be able to remove a bit more, but this part here, and it will continue into a tummy tuck in the front. Now, she is relatively flat here. Despite the volume here, she's flat in the buttock. So options are fat grafting or buttock implants, but for her, because I've got this nice amount of fat here, where you see the green hatched area, I'm gonna remove the skin, but leave this attached to her with blood vessels coming from here and going into it. There's a ratio of 1 to 2 to respect for blood vessel purposes. This will be lifted and put in a little pocket in the buttock. The buttock will be over. So that's going to give her a small but very nice roundness in to the buttock area to replenish some volume and some contour. We're going to remove this skin, do a bit of liposuction. We're going to turn her, and we will do a somewhat classic tummy tuck, but she has also excess this way, vertical. So when we do a tummy tuck, we remove horizontal skin and we close. You've seen many of my videos. But for her, we have extra skin here as well, above the belly button. When I will repair her muscle, I'm also recruiting skin from the side. It gives more excessive skin in the front. So for her, we have to do a vertical component to the tummy tuck, which we call the Fleur de Lis. Fleur de Lis is the French flower you may have seen on the Quebec flags, for example. It has kind of a horizontal part and a vertical part to the petal of the flower, and we call this procedure Fleur de Lis. I invite you to stay. I will show a bit later when we're on the front to show you the power of this procedure. Hello everybody, welcome back. This is part 2 of a lower body lift auto augmentation tummy tuck Fleur de Lis excision with a patient who's lost 150 pounds. This is Dr. Marc DuPere, plastic surgeon, Visage Clinic here in Toronto. I want to say thank you to my patient for agreeing to this filming. Now I want to show you, this part has been done. You can see the projection. I've done an auto augmentation, meaning I've used some of her tissue based on blood vessels. So it's pedicled. It's not fat grafting. It's a pedicle that has blood vessels that I've turned or transposed into a pocket to give her that projection, imitating a buttock implant. This part is not done. It's open. It's clean, but it's open. So I warn you, this is graphic. But I want to show you the power of this auto augmentation. This one has been done, and I think if you can show here how beautiful this projection is by using your own tissue. Without doing this auto augmentation, she is relatively flat. Usually this part here, we cut it out and excise it, but she wanted this auto augmentation. I've preserved the fat that we normally send away, discard. It's kept on blood vessels coming here like fingers that supply this piece of fat. I check the edges, it's nice and bleeding, so it's very healthy. I've created a pocket here as I would do with the buttock implant, and now I'm going to transpose it inside here. I'm going to anchor it to make a nice mound, and then the skin will be closed over like I did on this side. So I want you to appreciate the power of this auto augmentation. You're using your own tissue to project the buttock area. Stay tuned. We'll turn her in a few minutes, and then we'll do our Fleur de Lis tummy tuck excision. This is part 3. We've already done this morning the lower body lift on the back side. I've done liposuction to the back rolls. We've excised 15 centimeters of tissue all around on the top of the buttock, and I've done some auto augmentation. I just showed this. Now we've turned her. Now this is the connection from the back. So I'm going to continue, and I'm going to do a classic tummy tuck. You can see there's a lot of skin in excess. She's lost 150 pounds. What I want to demonstrate here is even when I remove this, there'll be some extra skin here. And for that reason, we have to give her also a vertical incision. And if you look at the shape here, it looks like the Fleur de Lis, the French flower, the Quebec flower that we see often in flags. And that's why we call it Fleur de Lis. The belly button will be at the same place, but I am going to free it. At the end of the procedure, there'll be a vertical scar, horizontal one here, and the belly button will be added back to that vertical line. I am doing muscle plication because I think muscle plication gives a better hourglass shape to our ladies. It does add a bit to the recovery, but this is all discussed in consultation together. Our patient is staying overnight. It's a long procedure. We do all things that are required to prevent deep venous thrombosis. For example, she's got the pumps. We're giving our patients some heparin. We keep them overnight. We walk them throughout the night. And it's imperative that the next day, the following few days, that they have help at home to keep ambulating. It's very important. This is a nice lady who's lost 150 pounds a few years ago and has been able to maintain that weight loss. We met a few months ago and we decided on a lower body lift. Her buttock was somewhat saggy. There was no fullness whatsoever, but she had large love handle and back rolls with this large hanging abdomen with lots of excess in the epigastric area above the belly button. A classic tummy tuck would not address the excess of skin here, so we've decided to do a classic lower body lift. So I did first in the morning the excision of the soft tissue at the back, lifted the buttock. I transposed some of her own fat as a pedicle to give her some convexity, some buttock projection. And then we've turned her, and I did a classic tummy tuck with the vertical extension. So when we see the pattern, it looks like a Fleur de Lis, the French flower. And I will show you the amazing result we got. It's a little bit graphic. First, I'm going to show you the amount of tissue we've removed, which are several kilograms. And just to show you, it's very impressive. The back tissue is not shown here, but this is the abdomen going into the love handle area, and this is the extension up to the breast, the belly button. Those small incisions are from the liposuction. So you can see that this is quite a large amount of soft tissue. So you can be reassured that this lady will be very, very happy with the result. And I will now show you the result. There you go. Beautiful, symmetrical abdominoplasty or lower body lift incision with the vertical Fleur de Lis extension, repositioning of the belly button. Bruising, a bit of swelling, quite expected. It's a long procedure, but I'm very pleased with this. I think she'll be very, very thrilled with this procedure. Weight loss surgery is a common practice at Visage Clinic. Common procedure that we do. We do all kinds of body lifting, thigh lifts, arm lifts, breast lifts. And today, this was a lower body lift with a Fleur de Lis tummy tuck. Thank you very much for watching. Have a good day.